I'm Amy Rosneck, and I'm one of the clinical speech-language pathologists at the Cleveland Clinic. I wish that people understood that a swallowing test is not pass-fail. There's variations of swallowing and what we can do to make people safe and to make them have a quality of life that they want to have. My role as a SLP is primarily seeing inpatients. I see adult and pediatric inpatients. The pediatric population I work with is primarily infants. So we're working on feeding as well as swallowing and to help their parents be successful in feeding them. And then I work a lot with adults, more so on swallowing and then some acquired language disorders as well. I am very fortunate because we do a lot of collaboration here. There's about 6 or 7 disciplines that all meet together before we even see a patient that day. We're very lucky that we have so many people around us to help support us and us to support them. It makes us a very successful team and that we can all have the same goal for our patients together. I think it's amazing that I can be doing something for like this long and I still feel like every day I'm learning something new. I really like our populations that have trach tubes to help them with their breathing. And when we can work with them to put a speaking valve on, oftentimes they will say, I never thought I'd talk again. There was a patient that I had who was a young man who's probably in his 40s and he had cancer. We were able to put a speaking valve on his trach and he was talking and he asked me if I could help him to call his mom. When she picked up the phone, he said, "Hi, Mom." And she said, "My baby." And just started crying, and he started crying. It just really drove home to me, like, no matter how old you are, your mom still wants to hear your voice. You just want to still talk to your mom, whether you're an infant or an older person. He was just so happy to be able to talk to his family again.